Dear colleagues, my name is Horst Sievert from Cardiovascular Center Frankfurt. Today at the VEITHsymposium here in New York, we presented our ideas about multi-organ denervation, and I wanted to share these views with you. So these are my disclosures. So in general, device-based neuromodulation is really a huge emerging field, and there are many different attempts also coming from the field of interventional radiology, how we can modify or modulate the sympathetic and also parasympathetic nervous system. In this lecture, I will focus on the catheter-based techniques at our upcoming heart failure meeting in Frankfurt in December. We will also talk about other fields which are other techniques in the field of neuromodulation. So what are the potential targets of endovascular denervation? I mean, beside those procedures which we perform for renal denervation for treatment of hypertension, well, other fields are liver, pancreas, and duodenum, and this is obviously targeting diabetes. Then we have the splanchnic nerve denervation, which is targeting heart failure. And then we have pulmonary artery denervation, which is targeting pulmonary hypertension. Just to remind you, you know that sympathetic nerves innervate not only the kidneys, but all other organs. And if you denervate the liver, the pancreas, the duodenum, and the kidneys, then this may result in reduced blood pressure, but also in improved blood sugar control and improvement in other metabolic diseases and syndromes. The first study we conducted in that field was the MODUS feasibility study, multi-organ denervation. We used a balloon-based radiofrequency technique. We performed denervation of the renal arteries and hepatic artery, and we included patients with type 2 diabetes plus hypertension on medications who were uncontrolled, which means HbA1c should be higher than 7.5, and office blood pressure should be higher than 135 millimeters of mercury. These are some of the results. It was a very small study which unfortunately had to be terminated early, which has nothing to do with with medical reasons or scientific reasons. You can see the 24-hour blood pressure measurements, and these are individual patients. And you can see that some of them had a blood pressure reduction of 40 millimeters of mercury, others of less than that. Only one patient did not have a blood pressure reduction, and the mean reduction was 22 millimeters of mercury. And there was a sham-controlled control group, sham procedure control group, and the mean reduction in blood pressure in this group was only 0 millimeters of mercury. Then we have the HbA1c, the diabetes control at 90 days. On the left side, again, the treatment group, and the mean reduction in HbA1c was 1.04, and in the control group it was 0.45. This difference was not significant, partially due to the small number of patients who could be enrolled, but it points into the right direction that this treatment may be effective. The second study we performed in this field, or the second device, was with the Nuvient multi-organ denervation system. Again, hepatic denervation plus renal denervation. We used a centering balloon with 3 microneedles. These needles are able to treat vessels diameters between 3 and 7 millimeters, and we injected a small amount of alcohol, 1 cc, into the perivascular space. We presented the results of this trial recently at the TCT meeting. That was the NECTAR-4 trial, prospective multicenter, this time non-randomized study, and we included patients on medical therapy with both uncontrolled diabetes and hypertension, and you can see the inclusion criteria listed on this slide. These are now, again, individual patients after 3 months and after 6 months, and you can see that the blood pressure was reduced in the majority of these patients. When you count 5 millimeter blood pressure reduction, which is clinical relevant blood pressure reduction, then the success rate after 3 months was 72%, and after 6 months it was 71%. These are now the diabetes control, that is change in HbA1c. On the left side 3 months, on the right side 6 months. And you can see again the majority of patients responded well. only very few patients did not improve their diabetes, and the responder rate was 78% and 74% after 6 months. Another target for endovascular denervation therapy is the splanchnic nerve denervation, which is targeting heart failure. So there you will remember or should remember that in patients with HFpEF, which means heart failure with preserved ejection fraction, there always occurs a volume shift from the splanchnic bed into the great pulmonary circulation and right and left heart chambers. And this volume is coming from the splanchnic vascular bed, and small increases in vasomotor tone result in a large fluid shift and high intracardiac pressure in these patients. The splanchnic vascular bed is innervated by the greater splanchnic nerve, which originates at the thoracic sympathetic ganglia. It crosses the diaphragm to innervate the celiac plexus, contains sympathetic and pain fibers. Increased activity results in selective constriction of the splanchnic reservoir and increased venous return, and decreased activity results in selective dilatation of splanchnic reservoir. Now, a catheter technique has been developed which is able to denervate these nerves. We go via the acigos vein and go to the intercostal venous system where the nerve is very close to the vessel, and then we can apply radiofrequency and denervate these nerves. So there had been a number of clinical studies regarding greater splanchnic nerve denervation. Before we came involved, there was a surgical trial which showed improvement in hemodynamics as well as heart failure parameters in patients with HFpEF. And then we did the transcatheter first in men in our centers in Georgia, which showed improvement in heart failure class, quality of life, and exercise duration and NT-proBNP. And then a randomized feasibility study with 90 patients. Unfortunately, this study was overall neutral, but they could define subgroups of patients who could potentially benefit from this therapy. So further studies are needed to define the ideal candidates for this treatment. And finally, pulmonary artery denervation. The background of this procedure is that pulmonary arteries produce catecholamines. Increased sympathetic activation has been observed in all forms of pulmonary hypertension, primary as well as secondary. Sympathomimetic drugs are associated with pulmonary hypertension. Sympathetic overactivity drives pulmonary hypertension progression. Sympathetic fibers run along the pulmonary artery, so they are accessible from the endovascular way. The idea is that pulmonary artery sympathetic nerves become pathologically overactive in pulmonary hypertension, leading to vasoconstriction and vessel stiffening. Animal models have shown that pulmonary artery denervation is effective, and we also, interventional cardiologists, we are always looking for new targets for our activities. Now, three different devices have been developed or used in the pulmonary artery field. These are the TIVUS system, the Pulnova system, and the gradient system. TIVUS is ultrasound, the others are radiofrequency. So I cannot go into all the details for time reasons here, but it has been shown that there are beneficial effects in different forms of pulmonary hypertension. All types of pulmonary hypertension benefit from this procedure. There had been first-in-man trials, multiple randomized trials. All the studies had been positive, including 3 randomized sham-controlled trials. So the evidence for this procedure is already now pretty strong. Different catheter technologies, radiofrequency and ultrasound, seem to be effective, and there's no doubt pulmonary artery denervation will play a significant role in the emerging field of multi-organ denervation. So in summary, multi-organ denervation is a new concept in neuromodulation. Patients with different diseases may benefit: hypertension, diabetes, metabolic syndrome, heart failure, as well as pulmonary hypertension, and new technologies are coming. So thank you very much for your attention, and hope to see you all at our heart failure meeting in early December here in Frankfurt. Thank you very much for your attention.